Hi, I'm Kolby, an instructor with St. John Ambulance, Alberta. Sudden cardiac arrest is one of the leading causes of death in the adult population in Canada. Today what we're going to talk about is some of the signs and symptoms of somebody having a heart attack or suffering from cardiac arrest, and we're also going to talk about some of the risk factors that are attached with cardiac arrest. Now, sudden cardiac arrest or cardiac problems being a predominant cause of death of Canadians, a lot of people want to know, so what are the signs and symptoms? How am I supposed to know if I or somebody else is suffering from this? A couple of key things that we can look for and we can ask the casualty about. First of all, pain. Are they feeling pain in their chest? It can also be radiating to their shoulders or their arm, up to their neck or their jaw. They'll often describe the pain as a crushing pain or a squeezing pain. Some people will even say it feels like there's something sitting or standing on their chest. What we can also do is look for pale skin that's also very, very sweaty or a lot of moisture on their skin. It's one of the signs that comes along with cardiac arrest. They'll often be complaining of nausea, having severe indigestion, and in fact, lots of times having a heart attack can often be mistaken for having indigestion, and some people can actually delay going to a hospital for treatment because they think it's indigestion. Although one of the things that will come along with cardiac arrest sometimes as well is a feeling of fear or impending doom. Sometimes people delay seeking help because they know that their body is suffering from something serious. But getting medical help at this time is a key thing that we can do. So we want to learn to look for the different signs. Are they feeling pain, that crushing or that stabbing pain or that squeezing pain in their chest? Do they look pale? Do they have really sweaty skin? Are they complaining of nausea, indigestion, lightheadedness, shortness of breath? These are some key things that we can talk about or look for when looking for the signs and symptoms of sudden cardiac arrest. Now, one of the other aspects is, how do I know if I'm at risk of having a cardiac event? Well, there's some risk factors that we talk about. Now, there's two types. There's controllable and uncontrollable. Now, the uncontrollable risk factors that they list off: age, gender, and heredity. These are things that we can't do anything about, but predispose us to having risk factors or having cardiac incident. Now, the controllable risk factors: diet, obesity is a concern, lack of exercise, excessive stress, high cholesterol, high blood pressure, cigarette smoking. These are all factors that will make us more likely to suffer from a cardiac event. Now, just because you have one or two doesn't mean that you're at really high risk, but the more factors that you have combined with the controllable and the uncontrollable, the greater at risk you are. So you always want to take a look at your lifestyle and be able to determine what level of risk do I have. Remember, in an emergency, it's people like you that can do the greatest amount of good when you first come along a casualty. What we've just seen is a small piece of what you would find in a CPR course. To learn more, visit our website today.